I'm going to perform a physical daily assessment. Before I enter the patient room, I have to check the medical record for their labs, the most recent lab, new order, or needed order. And also, before entering the room, I have to check if they have any precaution or anything that I should be aware of before getting in. Knocking to the patient room, checking outside of the patient room if there's any precaution. Washing my hand or using a hand sanitizer. Marshall, I will be your nurse for today. Can I have your first and last name, also your date of birth?
Joseph Marshall, 1/1886.
Have the right patient. So what brings you here today?
I had lower abdominal pain on my left side a couple hours ago.
Okay. Can you tell me where you are right now?
South Coast Hospital.
Can you tell me what year are we?
2025.
What season?
Spring.
And who's the president?
Donald Trump.
Patient is alert and oriented ×4. If he's not fully alert, we're using the Braden scale. 13 to 15 is indication that patient have a mild injury. 12 to 9 is moderate injury, and 8 is less than 8 and less is severe injury. I am going to test your upper and lower extremity. I'm gonna put my hand over your shoulder. If you can shrug it for me. Can you squeeze my hand? Can you rotate it inner and outer? Can you raise your leg one at a time? In and out one at a time. Lower extremity, bilaterally strong. Patient gesture is relaxed and also aligned, and there is no odor. And also he can verbalize or express his needs and also able to hear me and answer my question appropriately. So I'm going to check your pupil size. Follow my pen right. Pupil size bilaterally is 3 millimeter, and pupils are equal, reactive to light and accommodation. So I'm going to proceed taking your vitals. I'm using a temporal thermometer. The temperature is 97.4. I'm going to listen to his apical pulse for 1 full minute. Pulse rate is 82, respiration is 18, and I'm going to check his oxygen saturation. It is 97%. If we don't have any pulse oximeter, there are indication or clinical judgment indicated that the patient is in distress. One of them is checking their mental status, capillary refill, increasing heart rate, and also their skin. If it's bluish or cyanosis, it's indication that there is no oxygen. And so do you have any cough?
No.
And also, if patient is in any respiratory equipment, we need to make sure that we have the feeding size, we have the right order, and also it is working properly. And when they're using an incentive spirometer, we need to educate them to breathe slowly and deep. Also hold it for 5 seconds and then let go. Or breathe normally. So I am going now to listen to your lung sound. Take a deep breath for me. Take a deep breath. Take a deep breath. Take a deep breath for me. Take a deep breath. Take a deep breath. Also, I'm auscultating the lung sounds over the clothes. Can you lean forward for me? Take a deep breath. 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 Patient lung sounds, anterior and posterior, is clear. There is no any adventitious sounds that I heard. So I am going to listen to your heart sounds using the diaphragm. I'm gonna start in aortic. Pulmonic. Erb's point. Tricuspid, and then mitral. I'm gonna listen one more time using the bell, the stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. So I heard S1 loud and apical, and S2 in pulmonic. And other than that, I did not hear any murmur or any abnormal sounds. I am going to check your capillary refill. Can you put your hands like this? 3 seconds, the blood return in your feet. Also, the capillary refill in lower extremities goes back in 3 seconds. I'm going to check your radial pulse. It is +2, which indication of normal. I'm going to check your tibial pulses. It's +2 as well. And I'm going to check your pedal pulses. It's +2, which is normal. So, the skin is looking at your skin or inspecting in the patient's skin. There is no lesion, there is no wound, skin is intact, and also it is clean. I'm gonna feel the temperature of your skin. It is cool, also weather is cool. So if the patient is a bedbound, they need to be repositioned every 2 hours. And also if they are in any applicator, for example, to protect their skin integrity, we need to check the order. If it's low function, and the settings. So I am going to inspect, auscultate, and palpate the abdomen. Is that okay if I'm going to raise your
Yes.
clothes? So patients allow me to doing the abdominal assessment under his clothes. So patient abdomen, there is no lesion, there is no wound, it is intact and it is round. I'm gonna start in your right abdomen, lower abdomen. Right upper abdomen. Left upper abdomen. And left lower abdomen. And now I am going to palpate it to feel for any abnormalities like tenderness. So I'm gonna start in right lower abdomen, right upper abdomen, left upper abdomen, and left lower abdomen. So he feel pain in his left lower abdomen. Can you tell me the characteristic of the pain? Is it
Sure.
sharp? Okay. Can you rate the pain for me from 1 to 10?
5.
Can you tell me what made it worse?
When I stand up and walk.
What makes it better?
Sitting down or laying down.
How long is the duration of the pain?
It's like 2 to 3 seconds.
Are you taking any medication to relieve the pain?
No.
Okay. When was the last time you have your bowel movement?
This morning.
Do you get your bowel movement like regularly,
Yes.
like daily? Okay. Are you in any special diet, or are you
Nope.
in regular diet?
Just regular diet.
Okay. Do you have difficulty urinating?
No.
What is the color of your urine?
Clear.
Okay. If patient expressed that he has difficulty of urinating, and yeah, we have to do a bladder scan, and we also might run some testing. And also, like, additional question, during walking, are you able to balance yourself?
Yes.
Okay. And is there anything else that I can help you with, or any concerns that you wanna tell me?
No. Just my lower abdominal.
Okay. Yeah, thank you for answering those questions for me. So before I leave the room, I have to make sure that the patient bed is in the lowest position. All the side rails are up if it is indicated. Also the bed alarm if it's indicated. And also I have to make sure all the brakes are locked. And I have to wash my hand or use a hand sanitizer.